Hi, everybody, and welcome to the Ability Summit and our session on the science behind mental health. My name is Megan Lawrence, and I'm the Senior Accessibility Evangelist here at Microsoft, as well as the co-lead of employees with mental health conditions. I'm a white woman with long, dark, curly hair and a red shirt on today. Now, I cannot be more excited by the panelists that we have brought together to really dig into how do we measure mental health, well-being, and happiness. What's the science and the research behind so many articles that you're seeing in the news today? And what is the lived experience like for so many of us that have mental health conditions here at Microsoft? So with that, I'm going to turn it to my panelists to introduce themselves. Dr. Hall Brown.
Hi, my name is Dr. Tyish Hall Brown. I'm a licensed psychologist and an associate professor at Howard University. I'm an African-American female with dark brown hair, and I'm wearing a black shirt. I specialize in child and adolescent psychology in areas of anxiety and sleep.
Yep, my name is Meik, Wiking, and I run the Happiness Research Institute here in Copenhagen. I'm a Danish white male in my early 40s with brown grayish hair and a big beard with gray spots. And at the Happiness Research Institute, what we do is we try to have a scientific approach to happiness, well-being, quality of life. We look at how we measure happiness, how we can understand why some people are happier than others. And thirdly, we try to understand why is it, or how can we improve quality of life.
Thank you so much. Beth Ann.
Hi, everyone. My name is Beth Ann Katz. I am a program manager at Microsoft on PowerPoint. And I'm also the lead of the California chapter of Microsoft's Disability ERG. I'm a white woman in my late 20s. I have long, brown, very curly hair, and I'm wearing a bright yellow sweater. Thank you.
Fantastic. So I really want to dive right in and talk about the fact that there really are different models that we see with disability. Traditionally, we've seen more of a model in which we think about the individual carrying the responsibility of disability and moving now into a social model where we recognize it's our environment, it's the people and the culture around us that actually creates access and inclusion. And so one of the things I often say is that mental health is not the responsibility of any one individual. It's actually the opportunity that any organization has to create these cultures of emotional inclusion. Inclusion is a verb, right? This is the act of creating an environment in which people have a sense of belonging. And so think about that as we go through our talk today. How are you actively creating a sense of belonging on your team, maybe with friends and family, within your larger community, the cities and the countries that we live in? But with that, I really want to dig into this. I mean, if anybody over the last year during the global pandemic has not been reading public media, first of all, congratulations. Second of all, I think we've all seen numerous articles that really show the impact that the global pandemic is having on people's mental health and well-being. We see large numbers of people being diagnosed with mental health conditions. And in fact, we're the largest community in the world with disabilities and the fastest growing community of people with disabilities. But with that, given that we have seen so many articles, I really want to turn to you, Dr. Hall Brown, and say, all right, help us better understand, like, what is the research behind all of these statistics that we're seeing, and how do we think about that data?
That's a good question, right? I think we have been inundated with data and just research and stats and all of that. And to some extent, it's been helpful. And then to other extents, it's probably been overwhelming for people. I think when we think about the data or that we think about the research that's coming out, we need to be excited about the findings, be excited about what's out there, but also look at it with a critical eye so that we can understand how it may apply to us as individuals, understand who took part in this study, like what was the sample like, what was the age range within that sample, and then also what were the findings. So that's also the important part. We know to look for the findings, but outside of the findings, what are some of the limitations of the study? Because I think what happens a lot of times is we have a finding and then people want to generalize that across all different types of samples. And we really can't do that. And so it's really finding a happy medium of being excited about what we found, but then really figuring out how to apply that to us in everyday life.
Yeah, I mean, I think that's incredibly useful information. And we actually do see increasing studies that are showing what is the impact on, students, or what is the impact on different populations. And so I want to revisit that. But Mike, kind of what are you seeing in some of these larger data sets that you see around the world?
Well, I'm really excited about what is happening globally, both with academic research, but also in terms of policy and governments and international organizations moving into this space. And to me, it's been really wonderful that we, for the past 10 years, have actually had a UN resolution on happiness. So the United Nations asks all the countries of the world to focus more on well-being and see what they can do to improve quality of life. And we're seeing countries doing exactly that. Of course, famously, we have Bhutan, that since the 70s have used gross national happiness. So instead of gross national product, they look at whether people are actually getting happier in the country. Recently, we've seen the UK now also implement annual surveys of quality of life among people in the UK. And recently, New Zealand passed a well-being budget. So now policy decisions or questions about policy has to come with an assessment on how is this going to impact well-being and quality of life for people. So a lot of good news in the policy department.
I personally am so thankful that we're beginning to think of this as the way that any organization, whether it's Microsoft or a country, is beginning to understand itself and ask questions that maybe we haven't traditionally been asking. But I think the hard reality is that, mental health and mental health conditions specifically still carry a lot of bias and stigma. I really do think over the last year, we've broken down that barrier quite a bit. And I call that a COVID silver lining, which is that we've shown the light on something that frankly has just been happening kind of secretly. But Dr. Hall-Brown, how do you sort of see that stigma impacting, the research that we see?
Well, I think that the research that comes out is helpful in the sense that it can, I'd say reduce some of the misinformation or some of the myths that are out there. So a lot of times stigma is based on things that we just don't know too much about, and we kind of make information around that, or we have little bits of information and then we kind of pull from that little bit and make this global comparison or generalization. So I think the research helps us to be able to understand what the facts are, what we actually know about things, as opposed to going from these little tidbits of information that we're not really sure about. So that's one positive about it. I think the other side of it, though, is when we think about research and we think about how it separates perhaps different populations and has findings that are within certain groups. But our goal and our charge is to make sure that people, again, understand what that means for each of the groups, because it's important for us to know how each of these studies, how wellness, how mental health impacts each group, each kind of subgroup that's out there. But we want to know then what can we do to support those subgroups, not necessarily ostracize them or make there be more stigma around those groups because we have these findings. So I think the research is important. And again, it's how we use it, how we interpret it, and what we really understand about it that I think are at the crux of the research and of the findings.
Yeah, thank you so much for that. And Mike, you and I were talking, we've had several conversations on well-being and the fact that we are beginning to see this move into some policy realms. But you said one of the questions that you get asked the most often, which is, there are certain countries that seem to have higher quality of life scores. So do you want to talk a little bit more about some of that, the politics and the policies and what you see going really well?
Yeah, I mean, if we take a report like the World Happiness Report. It's an annual ranking of life satisfaction across 155 countries. We can see there's actually relatively few factors that explain the variance between those countries. So actually 6 factors. So GDP per capita, healthy life expectancy, freedom from corruption, so good governance, freedom to make life decisions, generosity in society, and social support. So do we have somebody we can rely on in times of need? And that actually comes back to your point, Megan. around how inclusion is incredibly important in terms of increasing quality of life for people across the world.
Yeah, one of the things that, I often talk about is that, mental health and well-being, emotional well-being it's on the spectrum. So for example, I have a permanent mental health condition. I have an anxiety disorder. But we recognize that during the past year, everyone has had an experience where they have had an emotional reaction, both positive and negative. I know I certainly have both. And that maybe homeschooling children or taking care of ill family members has created more temporary mental health symptoms where, you are really trying to find that right balance. And, I know every listener out there has had an experience where they've had a big work deadline or, a big function that they were preparing for that frankly was just stressful, right? Like, I unfortunately had to work a 16-hour day to get things ready. And at the end, I was done. But that's a reality. And I was so pleased to be able to contribute. But, as we think about that spectrum, Meik, I want to come back to you and talk a little bit more like, okay, so you've talked a little bit about how we measure happiness itself. Do you have anything to add on what that means for people across this spectrum?
Yeah, I think one of the key challenges we are facing these days in terms of well-being research and also spreading that research to a wider audience is improving the language in which we talk about well-being, quality of life, happiness, mental health. It is a complex umbrella term that we read different things into. So Dr. Hall Brown has one idea of what well-being is, or what happiness is, or what the good life is. I might have another one. And what we need to do with these complex umbrella terms is to break them down and look at the more precise, smaller components they consist of. And it's also what we do when we talk about complex terms like the American economy. We break that down into GDP per capita, inflation, unemployment rate, exports, and so on. And that gives us a language to talk about how is the American economy doing. And I think that's also what we need with well-being and quality of life, mental health. Break it down, have a more precise language when we talk about these matters.
Yeah, I love that. And, Beth Ann, I recently, was introduced to you and had the opportunity to actually co-lead a session with you. And I was incredibly blown away by some of the ways that you're really thinking about the way that you track your mental health and how you're improving it over time. And I'd love for you to share a little bit about your personal story.
Mm-hmm. So personally, I have lived with a diagnosis of major depressive disorder and generalized anxiety disorder for several years. And I started noticing, perhaps because of the product experience I have, that there were ways that I could track my mental health similar to how I track software reliability and software improvement. So what I did was started to be more intentional about that and really identify what are the things that I'm doing differently when I'm in a good mental health state and when I'm in a poorer mental health state. And the benefit of doing that is, one, a better understanding of how I'm doing. Even if I don't particularly feel good or bad, I can look at other indicators to understand the state of my mental health. And that can help you understand trends. In software terms, this would be the equivalent of reducing the time to resolution of an issue. So if I'm able to identify that I'm going into a crisis state sooner, I can be more proactive about getting the help I need and taking the action I need to do that. So that's the system that I came up with and that I use personally to help manage my own mental health and well-being.
Yeah, I love that metaphor. And increasingly, we see technology that is assisting. So do you use any technology, or are you, I know, is it an Excel spreadsheet? Like, how do you do it?
So it's a combination of technology. And at this point, for the number of years I've been living with these conditions, it's kind of just like a background process where I'm constantly pinging myself and paying attention to these things. But yes, one of the tools that I like to rely on and that I like to evangelize is mood tracking apps. For product management, software management, turning very intangible things into metrics is a great way to be able to pinpoint problems, trends, all that stuff that makes it possible to track and move metrics. And mood tracking is a way that it's kind of done for you. There are apps that have thought about this problem. So one that I use every day or at whatever time period you like, you can put in like, how am I feeling on like a 1 to 5 scale? And then at the end of the week, it'll give you a summary of like, here was your average mood. You can see the breakdown per day. And it also allows me to track the specific things that I did that day or write notes to myself. And so that can help find correlations between different things. And also just the note-taking part is a little bit of that getting something off of your chest that's built into it as well. And these days, since I'm doing so much of the background processing to track my mood, I think mostly I use it on like very emotional days, something very, very good happened or something very, very bad happened. And I think nowadays I'm using it more just for that release portion and less for the intentional tracking, but still both benefits are amazing.
Interesting. Yeah. So a journey. I mean, I feel very similarly. I've been on a long journey with my own mental health condition, not only in the way that I understand it, but in the way that I communicate it. I really didn't tell people that I had a mental health condition until about 3 years ago. And that really came down to the inclusive community that I found here through our disability employee resource groups. So again, I can't encourage people enough to be thinking about how are you creating inclusion, because that gave me the courage, frankly, to find my own voice and sort of speak up. And I think that it's important for people to know that they're not alone. But if you've talked to one person with an anxiety disorder, you've talked to one person with an anxiety disorder, right? I mean, I love Dr. Hall Brown, how you say, we need to understand populations, but this is so individual. So I'd love to hear a little bit more from you around, how do we think about research and science and individuality in the way that we think about self-care?
Well, I have to say, I love what Beth Ann's doing. I mean, honestly, she has taken the technology and found what works for her. So the research gives us almost like a guidepost or a starting point that says, hey, these things work for a large group of people or have worked for, a group of people. But then we have to kind of funnel that down to the individual and say, well, what's going to work for me? So for her, she's found a way to track, figure out how to use that data that she's collected to then support her daily activities and to, be successful. And so I love that idea. And again, I think on an individual level, we have to find what works for us. It's trial and error sometimes. It may not be the very first thing that we try. And I say that even, as a therapist, the first therapist you try may not be the best therapist for you. So you keep trying, you use the science and the research as a guidepost, but ultimately what we want to do is find what works best for the individual. And again, that could be taking components from different places. It could be something that's already set in place. It could be something as much as you're reading something, you feel like, okay, this fits for me. Let me try it. Let me see how it works. And, give it a week, maybe, unless there's some bad results. Things don't often happen instantaneously. I think we have to remember that as well. But trying different things that fit for you and that work for you are going to be important, because I think it was Meik that said that everybody kind of experiences these things differently. And Megan, you were talking about it. Even just because you meet one person with anxiety doesn't mean you understand everybody with anxiety. So each person's a little bit different, and therefore our approach may be a little bit more different as well in terms of what fits into their lifestyles, what fits into what's comfortable for them and manageable for them.
Yeah, my poor husband, I tell lots of stories about him. I mean, he's so sweet and amenable to being part of my conversation. But it is, Megan doesn't stop when she leaves work, right? And I have a whole life. And it is really my friend and family component as well that make up how, I am managing my own mental health and well-being. So I'll tell one funny story, which is, this is a couple of years ago. My anxiety was really, really high. I was not taking care of myself in the way that I needed to in order to get the downtime that I needed. I was just running really hot. And my husband said, "You're like a cat on a hot tin roof." And I kind of said, okay, but what that led to was a language, which was when he sees me not doing well, because he sees me in different states, right? He will, this is so embarrassing. He will literally come up to me and go, meow, meow, which is a little cat sound to mean, hey, like you're starting to hit the zone. But it sounds silly, but it's actually been so effective because it's a place of love. It's a place of caring. It's not confrontational. And I'm like, oh, okay, great. Good feedback into the system for me from my larger ecosystem, here. So, I think that there's this really interesting concept, and we might have parents on the phone that also have children that they are caring for that have mental health conditions. So turning it back to you, Dr. Hall Brown, around the work that you're really doing around adolescents and children, and what does that look like?
So we absolutely incorporate what you just described, which is trying to make sure there's a shared language between the adolescent and the parent, because sometimes we just do a lot of work with the adolescent. They're in our office, we're talking to them about things, but when they go home, the parent may be using a different language or not understanding what's happening or what have you. It takes everyone around the individual to support the individual. And so making sure that there is a shared language and that they understand what's happening with the student or the teen is extremely important. So I'd say when we're talking with and working with teens and families, open communication is huge. I think, we say that all the time, communication is a big deal. But being able to have these discussions with your teen or your child at a developmentally appropriate level. So, we don't want to keep them in the dark about what they might be experiencing or what you might be experiencing. But having those conversations at a level that's developmentally appropriate can be very helpful. So, for example, if you have a 6-year-old, you may be talking about depression in terms of a sadness, a feeling that comes and goes, or a feeling that makes it difficult for you to do things throughout the day. But when you're talking to a teen, you may get into more precise language about it so they understand exactly what depression is and how that may connect with either how they're feeling or what they're doing, or how that may connect with the parent in terms of what that means for the parent's mood and their ability to function throughout the day. So I think, making sure that you have the shared language, you have communication, you're talking to them at a developmentally appropriate level, and that you normalize this, right? So if a child is going through something, it's not just that child. They're not the only ones who've ever experienced this. And not to take away from their experience, but to share with them that there are other people who are going through this, who might be going through this as well. And I think the same thing as, for the parent.
Oh my gosh, normalization. To me, that has been, again, one of those moments over the last year where we've really normalized the concept of, we are emotional creatures. It's part of being human. It's what makes us intelligent. It's what makes us creative. And, I'm happy to see that we're not shying away from the, how are you doing? And that those responses might be not great today. And that's an okay answer, because I think we have so traditionally covered so much. I know I personally have, which is if somebody asks me how I'm doing, I'm like, oh, I'm fine, but I'm not fine. Right. And again, I think that kind of comes back to the culture. So Beth Ann, given the work that you're doing in the ERGs, how do you see Microsoft as a large organization? I'm going to come to you, Mike, because we're kind of like a small city, right? Depending on where you come from, we might be considered a big city. How do you see us creating cultures of inclusion, or what do you think we need to be doing more?
Mm-hmm. So I am very proud of so many of the steps Microsoft has taken to build an inclusive culture. And I know that you, Megan, have been a large part of that with the groups that you run about supporting employees with mental health conditions. So one of the first things that I'd call out is make sure that those groups exist. The fact that we have a disability ERG, the fact that we have those employee networks, we have a neurodiverse group on Teams where folks can join and find people to talk to this about, allies to support them, or people to ask their questions to, is so powerful. A couple of the other things that I think we do really well is having an employee assistance program. I know when I joined the company back in 2014, that was actually one of the first resources I leveraged to find my first therapist here. And it was really amazing because not only is it something where they will help pay for some number of sessions, but also because they did the legwork of finding somebody with an availability. And if you have ever tried to seek out therapy, you know how hard that can be to find somebody that's on your insurance, that has an appointment soon, and that is a good fit for you, as was mentioned during this conversation. And Microsoft made that so much easier for me as somebody who was also covering at the time and really scared to even have this conversation. A couple other quick things is that I love that we have put culture into our deliverables. We actually have to write that down as something that we're responsible for as part of our business responsibilities. And so I can talk about the work with mental health that we're doing, and it's something that is intentional and it's rewarded. It's not something that we're expected to just spend additional time on and not get any recognition for. And a couple other things is that I love that we can support proven mental health literacy programs. So on my team in 2019, back when we were in the office, we brought in a couple suicide prevention trainings, which was so powerful so that folks knew what to do if they were in that crisis. They had the language to talk about it, and they had the resources to be able to do that. And the last thing I wanted to share is I love that we have articles about this on our central news site at Microsoft, where employees do open up about their mental health conditions or just about the whole spectrum of mental health that we've talked about. And that makes it a much more open culture for folks to feel empowered to be able to take a sick day for their mental wellness, to use the well-being days that we were just granted because of the difficulty of the pandemic. So there's just so many great examples that I think we can learn from at Microsoft.
Yeah, I agree. I think, we are opening up the conversation. We are providing resources. So if anybody listening today is in need of benefits, resources, please do not be shy at all to reach out to an HR partner or go to the Be Well site, which is a wealth of information. I know I am leaning into a wellness coach, which is really helping me think about how do I balance work with exercise, because I throw out exercise as the first thing, right? So that's just another resource that I've been thinking about. But kind of coming back to this concept, you work with so many different kinds of organizations. What are some just overall trends that you see when it comes to really helping a large organization create these kinds of cultures of inclusion that lead to quality of life?
I honestly, I think it is doing what you're doing right now and what Dr. Hall Brown said before, normalize the conversation around mental health that you, Megan, and you and Beth are also ambassadors for. And before, Megan, you mentioned Denmark and what's been going on there. I think one of the biggest improvements in terms of quality of life, especially for people living with mental health conditions in the past decade in Denmark, have been a normalization around the conversation around mental health. So there's been national TV shows where celebrities, politicians, ministers, movie makers, directors, athletes have talked about their mental health conditions openly, which have normalized the conversation in Denmark around mental health, which has been tremendously important, I think, for overall quality of life. And secondly, because you are a technology company, I think also learning from Anne Beth, great example with tracking well-being. I think there is tremendous opportunity there for especially from a research point of view, collecting data, understanding the patterns in the data. How do we shape good conditions, including environments, including work environments that allow people to flourish? I think that's where we can take great steps forward in the future.
Data is what I'm hearing, which, is incredible because, one of the things that we recognized as a company is that, we traditionally have not had enough data about people with disabilities at the intersection of diverse identities such as race, gender identity and such. And so the AI for Accessibility team ran a workshop earlier this year that really looked at what is the intersection of mental health, the Black African American community, and data and bias, right? Because if we're going to continue to create great technology, we've got to make sure that it is culturally competent. I'm going to do the thing where I'm going to give each one of you 30 seconds, which is totally not fair because I'm going to ask maybe the biggest question of the session, which is what role does technology have to play in all of this? Okay, so I'm going to start with Dr. Hall Brown. We're going to go to Beth Ann, and we're going to close out with Meik. All right, Dr. Hall Brown.
Wow, you're right. Big question, but I love it. I love technology. I'm a technology geek. I think one of my areas of interest is sleep. And so we've been really trying to find ways to incorporate technology in tracking sleep of teens and looking into their environments or having a way of understanding what's in their environments that might be impacting or influencing their ability to obtain adequate sleep. We know sleep impacts kind of all of our function throughout the day, our ability to be successful academically, all of that. And so for us, the idea of being able to incorporate technology into spaces, particularly when you're working with teens and adolescents, to engage them and to attract their attention and their focus is key and very important. So I would say in any way that we can capture meaningful data points and include technology, that we're doing well. That's the goal, and that's the key.
Right. Beth.
So for me, I think that the barriers that are being broken down by technology to get access to help are some of the most powerful. Personally, with the pandemic going on, my therapy sessions have changed to being done over Teams, which has been super helpful on a personal level, and also just helped me get the access in a time that if this didn't exist, it wouldn't have happened. And I see that with things like crisis hotlines, where they used to be just phone calls, and now they have text versions available and online messaging versions available, which I was able to leverage when someone I knew indicated some crisis-like symptoms. And I could just send them a message, which is much more comfortable for me than hopping on a call. So I think those things that are making therapy more available, making resources more available over the internet is very powerful.
Mm-hmm. Key access. Yeah. Meik.
I think it's 30 seconds. I want to squeeze in 2 points. I want to squeeze in having large data sets. People like Beth Ann, when we look at it at an aggregate level, when we have tens of thousands of Beth Anns, we start to see pattern in the data. And especially, and that's the second point, also building on what Dr. Hall-Brown said, was combining data points, combining subjective with objective data points. We carry our phones around. If we have the mood tracker that Beth Ann talked about earlier, and we look at the GPS data, also collected by our phones, can we then start to see patterns? Where are people physically in an environment where they feel happier? That's what I'm really excited about going forward.
Yeah. Okay. So as a geography nerd, I literally have 3 degrees in geography. They were like, you can't stay. You have to leave now. I absolutely agree with you that understanding our physical environment and our mental health is a really critical and important question to be asking ourselves. I'll give you one example for myself is that I love Viva Analytics because it gives me a purple square every time I do not go back online at night. And so I literally use that to keep myself honest. And it's become a great conversation with my manager. I'll get a ping that says, get a purple square, which is, I care about you. I care about your mental health. Take the downtime that you need. So again, kind of coming back, I think, to, what's the language, what's the shared language we have around mental health, and how is technology enabling us to communicate and learn about ourselves. So with that, I want to thank each and every one of you. Just incredible commentary on a topic that is so top of mind for every single person, not just because of the pandemic, but because we recognize that mental health and emotional well-being is part of being human, and that we see disability as a strength here at our company. And it is the work and the research of every single one of you that helps bring light to how we create an even more inclusive world that is supportive of people with mental health conditions. So with that, I want to say thank you. And I encourage everybody to go and listen to additional sessions from the AI for Accessibility team that are really going to dig in and look more at this data component. Have a great day. Enjoy the rest of the conference.